next panelist is Ms. Louise Cole. Louise is the Travel Pass Implementation Manager for the International Air Transportation Association, or IATA for short. Previously, Louise was the manager of Identity Solutions, where she had the responsibility for the development of standards and recommended practices in robust, integrated identity management across the end-to-end passenger process, or IATA One ID. Prior to her work at IATA, Louise was in a leadership position with the New Zealand Public Service for 20 years, most recently as a manager of information partnerships with the Department of Internal Affairs. Louise, thanks so much for your time. And same question to you. From your role and perch at IATA, what are some of the efforts that you're helping to lead there in the international air travel space around the issuance of vaccination certificates and the verification of them?
Thank you, Brian, and thank you to the other panelists. It's been really interesting hearing the different perspectives today. Certainly, IATA's position here is when our industry is on its knees and needs to get moving again. And we need to make sure we can do that safely and coordinate safe return to travel so that people can travel for their business, to see their loved ones, or take a vacation, which I'm counting down 10 days before I myself can do. The IATA Travel Pass is often referred to as an app. And sure, there's an app in there, there's an app at the heart of it, but it's really an ecosystem. We're not in the business of issuing health certificates in any format at all. In fact, we want to see documents that we can, credentials that we can consume and verify and use in a way that makes it easy for everyone in the process. The ecosystem itself has a number of different components, and the power behind it is a tool called Timatic. It's been around for, believe it or not, 6 decades. A little bit older than I am, and it has it started as a book. It wasn't automated like it is now, but every single government in the world for the past 6 decades has given their border entry requirements to IATA as the industry association for airlines, in order to let them know what the entry requirements were. Now, mostly this is about passports and visas, although there has been some health data required at different points in different countries. Yellow fever, of course, we mentioned the lovely yellow vaccination certificate earlier. And this would inform airlines so that airlines could manage passengers and say, okay, you have the required travel documentation to go to your destination country. If you've ever known anyone who's got to the airport and hasn't been able to fly to Thailand because they've only got 3 months validity left on their passport and Thailand requires 6, it's not the airline doing that to you, it's the government requirement. And these requirements vary, and some of them can be quite comprehensive. So Timatic has sat there in the background for a very long time. It's been used by the majority of airlines and every single government. And last May, it went crazy. It went from a 9-to-5 team to a 24/7 team. At the height of the pandemic in May last year, the team were making an update every 7 minutes. So it made sense to begin to actually work to develop a rules engine that was specific to COVID-19. And there was also an emerging need to make that information available directly to passengers. There was the project referenced before, One ID, that IATA had been working on for many years towards using biometric digital identity in order to facilitate seamless travel. It was seen at the same time that this was a way that could also manage contactless travel in an airport environment and stop the constant handing over of documents, which is not really something you recommend in a pandemic. In addition, always had been the intention to manage facilitation and smooth, get rid of queues and long wait times. Again, not ideal in a pandemic. So work was accelerating to bring that project to fruition with digital identity. And it made sense to marry these two things, to take passengers' digital identity, travel document requirements, passport requirements, create a digital passport to the ICAO standard, and then marry that with the requirements for the destination. So Travel Pass starts first with that digital identity process. It authenticates using the biometric technology and the biometric in the passport chip to authenticate this passport is a genuine passport issued by the appropriate passport authority. It hasn't been tampered with, and the person who's presenting this passport and creating this digital identity biometrically matches to the photo in the passport. Once it's done that binding, you can then build on that and layer it with other travel documents, which increasingly originally was tests from late last year and now are very much vaccinations and other secondary documents required. So in parallel to this, that was seen there was a need to develop tools for laboratories to be able to issue secure, verifiable credentials. Travel Pass, the app itself, is based on the W3C standards, decentralized identifier communication protocols, and verifiable credentials. We're very much privacy by design, privacy by default, and the principles of Travel Pass align closely with the self-sovereign identity principles. Airlines do not want your personal data. They do not want the responsibility of holding the personal data, particularly sensitive data like biometrics. We want the passenger to be able to manage and control their data, and we want to have these documents in a format that's capable of either zero knowledge proofing or selective disclosure with the real data minimization focus. So the next part of this puzzle was the labs, and having labs in the network that could issue credentials and labs that were able to be registered in the IATA Travel Pass process to say this lab is a lab that is trusted to issue these tests. So that's the emergence of inappropriate tests, inappropriate actors, fraudulent actors in the system was quite quick once we started seeing testing requirements from late last year. Governments were very builder authorities, health authorities, rightfully nervous about this and needing to know that there was a pathway to verifying these. So the issuance of the credentials to the lab was a big focus of the initial work. And then more recently has been the consumption and the verification of the vaccination certificates. It was disappointing to not have a global agreement on a standard for a vaccination certificate in terms of the verifiable component of that. While the data elements are agreed, the different options, EU DCC, ICAO VDSNC, and smart health cards, the DVOC open specification that's emerging in Southeast Asia. So all of these don't talk to one another easily. IATA's approach is the same as it is with passports. We're building Travel Pass so that it's able to read and verify the different credentials, store them in the wallet in the user's device, and then enable them to be sent as a verifiable credential so that they can be turned into consumable data regardless of the way they have been inputted. So the solution where it's at now is we have about 68 airlines currently using Travel Pass, either in trialing or moving into production. We have another 70-something waiting to start their trials or in the final stages of signing agreements. There's a very large lab network and large lab registry that off the top of my head I can't recall the numbers of. We're able to consume and now verify the EU DCC, also which is test and vaccination. Tests go live in the app on August the 18th. We're still finalising the connection to the COVID rules engine. One part I didn't mention there, of course, is when you add your flight and you add your, you're showing all of the requirements of your destination country, which includes hyperlinks to any pre-declaration that you need to do. You're then guided to get the right test and the right information for the destination. when you receive your test or you consume your vaccination into your app, either wallet to wallet or from reading the QR code, it takes the flight data, the test or vaccination information, and it measures it against the Tomatic rules engine in order to return you a message to say you're okay to go to the airport, you're not okay to go to the airport, and here's why, or it's conditional, there's something else, there's something missing that you may be okay, but you have to see someone when you get to the airport. So these are constantly pulled up. So it's every time you pull it up, it's pulled through the rules engine again. So it's not a static result, because we know the requirements can change very, very quickly. And it could be you're okay to travel 70 hours out, but you're not okay to travel 24 hours out if the regulations have changed. So it's quite a comprehensive solution, and has been the hardest I've ever worked in my life. I'm sure there's many on this call that feel that way. And I can talk about it for hours and hours, so I might pause there so that there's room for others to contribute. But thank you, Brian.